All right. Well, good morning, everyone. It is a fantastic Monday morning here at Health Plan Markets, and we are in the middle of AEP. So thank you guys very much for being on the call this morning. We very much appreciate you taking time out of your busy week, especially on a Monday, to make this call. And as a reminder, we are going to continue these calls throughout AEP. So if you do have meetings on Mondays, please don't deter yourself from serving clients first. We understand that that's most important. So we are hosting these on YouTube. So just please remember that you can go out there and watch these calls after the fact. They're usually launched on Wednesdays. So just so you know what's going on. Also, quick note, I'm going to continue to mention this until it happens. We are going to be moving to a new Monday morning conference call service. More details on that, you will receive an email, and I will send you all the information coming soon on the new coordinates for the Monday morning conference call. So we're going to be switching systems to make it a little bit more efficient for everybody, and we're really, really excited today for that. So very good. So as we normally start, I want to remind everyone why we're here. We are here to improve the lives of our community with affordable healthcare. Thank you for being a part of that mission, and thank you for continuing the wonderful work that you're doing out there. It is going to be an exceptionally busy AEP, so we really appreciate everyone's hard work as we continue on this week. All right, we've got to keep one foot in the classroom and the other one in the field at all times. So with that, I am going to share my screen, and we're going to go through the trainings for the week. So here they are. Not much going on, but we've got a secret training we're going to announce here today. Very excited to share that with you. Nothing going on today. Tomorrow we've got Freedom in the building. So those of you that are in Orlando market, we have Mitesh Joshi from Freedom. He will be at our Edgewater location from 10 to 2 to help you with any questions, concerns, or rude remarks that you have for Freedom Healthcare this year. He will be in person and available for you. So if you need kits, if you need marketing help, whatever it is, he is going to be there and rocking and rolling for you to help out. We also have Ambetter training in Spanish from 12 to 1:30 on Tuesday tomorrow, and then from 2 to 3:30 in English. So Spanish first, and then in English at 2 o'clock. Ambetter is looking to dominate again this year for ACA, so pay attention to that. You can jump into one of those trainings and register and get that going. Moving on to Wednesday, we have our very own Al Clancy available for a coffee and chat session, and he's going to be there to help you as a guide. So if you have any questions or feel stuck, he is available for you there at 9:30 on Wednesdays. Our contracting department is going to be in our question and answer session from 11 to 12 every Wednesday. So again, contracting questions or onboarding questions or concerns, you have somebody that has an open door there from 11 to 12 every Wednesday. All right, we have a secret training. In just a few minutes, I'm going to put on Umar Khan, who is going to lead the charge on United One. And so this is a new ancillary product line that we're launching. And yes, it's in the middle of AEP. It's important, but especially for those of you that are doing ACA, it is the perfect time to look and add these products to your portfolio. So I'm going to share that with you, but we will have a training on, I think we decided noon on Wednesday. Is that right, Umar?
That is correct. That is correct.
Okay. Cool. So I'm going to go through the training, and then I'm going to pass the mic to you. We have a little bit more time than expected because our guest speaker is not going to make it today. So no rush on that. So just heads up. We've got Halloween on Thursday. So those of you that are going trick-or-treating, or if you are working, we have our HQ intro training at 3 o'clock on Thursdays. And then last but not least, it's already November 1st. This Friday, we have What About Shop for 2025. So those of you that are doing Medicare enrollments using HPM Shop, it is available and Tom is going to be available to help you get ready to rock and roll for HPM Shop. So, Boomer, I'm going to put you on at 9:15, and then you can go all the way to 9:30, just so you know. Sound good?
Guys, thank you.
Okay. All right. So that's the training for the week. And remember, guys, we got one foot in the classroom and the other one in the field at all times. So again, make sure that you are doing everything that you can to learn, because honestly, how are you going to share that great information if you don't know it, right? So there it is. Let's jump over to HQ. In case you don't have HQ, this is our all-in-one portal system, which we're making announcements from. I didn't do an announcement last week, but we are going to be doing several announcements this week. So it's really important that you come back and check this often. We love feedback. So if you have a idea to make this portal system better for you, please leave feedback here. We are always listening and we love your ideas. So the only way we can build it is if we know what you want, right? So a couple things I want to point out. On the contracting side, if you go down to all carriers on the left-hand side, you're going to see that we've got some new carriers here, but this is everything that we're getting ready to launch with our new onboarding process here. But I do want to point out a couple of key plans that are brand new. Scrolling down, you'll see the See More button, so we'll click that. And we've got Solis, which is a Medicare Advantage plan in South and Central Florida. We've got Sonder in the Atlanta market, and then we also have United Health One, which we're going to be talking about today for the ancillary products, as well as WellPoint. And I actually saw the first WellPoint commercial yesterday, so it looks like they're going to be coming in hot and heavy for open enrollment this season for ACA products. So if you are interested in adding any of those products or any products that you see in our carrier list, for now, you're just going to shoot an email over to contracting@askhpm.com requesting which contract you want, and we'll be happy to help you. Now, as we're continuing to build this out, we're going to have descriptions in here, what states are available, the product is available, what kind of product it is, and then any resources to help you make up your mind if you want to add that product into your portfolio. So this will be expanded as we're continuing to add products throughout the rest of the year, and into 2025 we expect to have some more products to get in the portfolio to help your clients when you're ready. But one thing I want to point out for the HQ is a couple things. The first thing is our AEP contest. I'm getting a lot of questions about that. And again, if you go to under resources, AEP Survival Kit 2025, and we've got our AEP 2025 contest here, you'll click that. And in the 2025 contest, this is the full video explanation of the contest, how it works, and where we are going. So just very quickly, the #1 Medicare agent will get to choose our destination for 2025. And we are either going to Cartagena, Colombia, Costa Rica, or the Dominican Republic. So those are the 3 locations to choose from. So the #1 agent gets to choose from one of those places. And then anyone else that qualifies gets to come along. So all the contest rules are laid out here underneath the video. We have the point system, what you get for each of your points, and then how to earn your points. We've recently updated our point system and to also include some of the carriers that are currently not on HPM Shop, like AvMed. They are going to be 2 points, but you will need to track that manually. Very soon we will have a link here to have this where you can click out and manually track your applications. So if you've done any of those applications, just make sure that you have that information so we can load it in so you get credit for those particular enrollments. So we've got our full points list here for the AEP contest. And so remember, these are preliminary points as we begin to track this. We're going to start tracking next week, so I'll be able to announce our leaderboard. We let 2 weeks go by so we can really see how everything's going. And we should be going mid-May 2025. And this is where the leaderboard will live on the bottom. So we'll be bragging on those top agents next week as we begin to add in names and get everything going. So that is where the AEP contest lives, all the details that you need. If you have questions, please let us know. All right. One thing I also want to mention going into Medicare for HPM Shop is we understand that the provider search is not 100% accurate. We've heard many stories about how bad the provider search is this year. What I can tell you is every year the carriers have to continue to update their networks, and so that's caused a massive delay in getting the data over to Connecture, which is our partner that builds HPM Shop. So the provider search is going to be a problem this year, but as I highly recommend that when you're doing any type of enrollment, do not rely on either Connecture 100% or do not rely on Spark. Now, Spark probably has a more accurate picture of what's going on with the providers. And so in your Spark platform, switch over here. In your Spark platform on the left-hand side, you have providers. And so you can put in a zip code and you can type in a provider name that you're looking for. And here you'll find the provider, what other locations that they do business at, their phone number, and then what plans they accept. Now, again, this is Spark's take on the provider list from the information that they're gathering too. But one thing that I want to mention when you're looking for providers or verifying providers are on the plan, there's some do's and don'ts. Number one, never call the office and ask them, do you take this plan? Why would we not want to call the office? Well, you're probably going to get somebody on the phone that is running the front desk that has 10 patients in front of him or her, and you ask them if they take United. Well, United has umpteen products, and so is it United Medicare? Is it United Medicare Advantage? Is it the PPO? Is it the HMO? Is it the DSNP? Is it the supplement? Is it the IFP product? Is it the ancillary product? There's so many different products that some of these carriers have that simply asking them if they take it is not going to be efficient enough or sufficient enough. So what I highly recommend is the true source of truth for verifying the providers is going to the actual carrier website. So in this instance, you'd go out to United Healthcare and you'd look for to ensure that this particular provider is in network. Okay. Do not rely on the provider's word for it because you're going to call and somebody's going to give you misinformation. Do not rely on HPM Shop. Do not rely on Spark 100%. If you want to verify and know that your source of truth is accurate, go by the carrier's website. Now, one thing also that we're noticing, at least until the end of November, is you'll have the option to choose the network for 2024 or the network for 2025. Okay, so make sure that you're selecting it for 2025 if you're enrolling them for a 2025 plan. Otherwise, you'll select for 2024. The networks do change from year to year, so keep that in mind. You might have a provider that's not going to be in network for January 1st, or you might have a provider coming into network January 1st, but it's not showing in the 2024 directory. So always use the carrier's website. Even if HPM Shop gives you, hey, I got 5 out of 5 doctors, that's great. The last thing that you want is your member going to the doctor's office in January and they cannot see their cardiologist or they cannot see their lung doctor, and you told them that they were in network. So it's very, very important as a reminder here that you're going through to the carrier's websites to ensure that the information is as accurate as possible. Okay. All right. Now, we're going to bring on Mr. Umar Khan, who's going to lead the charge. And who is Umar? Umar is our Rookie of the Year, not last year, but the year before, in Medicare and ACA, and he is excelling in the ACA space specifically, but he's also doing some Medicare as well. And so Umar had introduced me to a product called United Health One. No surprise, it's a United Healthcare product. And it's got some incredible ways for you guys to make extra money and complete the full circle of your client's health journey. And I was really taken aback at how these products can linchpin together with both Medicare Advantage and ACA products, individual and family plans. So I'd like to introduce Umer to give us a 15-minute speed through on what these products can do for your business, what they can do for your clients, and what they can do for your pocketbook. Now, we got Christmas coming up and all the holidays, so I'm sure the kids want the new Nintendo Switch and all that fun stuff. So this is a great way to start saving some money or making some extra money. And the money that he's telling me that you guys can make is just astronomical, especially on the bonus program. So with that, Umer, if you want to take it away and give us the good news, buddy.
Thank you, Justin. Very good morning today. A little bit cloudy where I'm at here in Orlando, but hopefully it'll get a little bit more sunny. Anyhow, just like Justin said, this is a extremely good opportunity that many agents are not currently taking advantage of and are not familiar with at the moment. However, that's our job, right? When we want to take over the Southeast, we want to make sure that us as agents are doing something unique that other agents are not currently doing in the market, right? So when we talk about Medicare agents, ACA agents, there are thousands of them, right? And thousands of agents are doing the Medicare, thousands of the agents are doing the ACA. However, very few of them are doing what we're going to talk about today. And as a matter of fact, this not only just like Justin mentioned can help you financially and have a tremendous increase in your income, but it'll also help the client in a way that they were not really introduced before. So without further ado, I would like to share my screen here and give you some examples of what the product is, what type of line of business it is, and how we can take advantage from it. Mainly today, I know we have 15 minutes, so it's not too much time, which we will host a longer training in the near future. But for right now, I would like to talk about some of the ancillaries that you can add on to existing member plans in the Medicare and ACA space. So let me share my screen here. Let me know if you guys can see it okay.
Good to go.
Awesome. All right. So this is one of our golden products here. And this is, of course, with that United Healthcare. And what we're looking at here is this plan is called Advantage Guard. Advantage Guard is a product that is typically meant to be put on an existing Medicare Advantage plan. Now, how United Healthcare has implemented that is you have a system where you can pretty much choose which carrier you want to put in. So, for example, I have Humana selected in here, and which plan you want to select of Humana, for example. And so, for example, if we select the 269 plan, which is a really popular plan here in the greater Orlando area, you're going to see a little chart here, which you're going to see the plan benefits on the left side, and you're going to see what Advantage Guard does for the client on the right side. And so many of us are familiar with this plan. Sorry if it's not in your state, but you're going to see the plan benefits here on the left. So, for example, when we talk about the Humana 269 plan, inpatient hospital is costing you $150 for the first 5 days, right? Ambulance visits are costing you $260 copayment, emergency room, so on and so forth. You can see that. Now, what the Advantage Guard plan will do is it's an hospital indemnity plan that is meant to offset the cost of your Advantage plan that you're already in. So, for example, by putting on an Advantage Guard as an add-on to the Humana 269 plan, you're gonna get $150 check each night for the first 5 nights. So that's gonna offset your cost for sleeping in the hospital on the Humana plan. For an ambulance visit, they're going to give you a $300 check, and that'll offset your cost actually it'll make you more money than offsetting your cost. So you take the 300, pay the 260 off, and the other $40 is pocket money at that point. Emergency room, you can see the same type of situation here where they would give you a $200 check and 140 of that would go towards the Humana. The rest of it is your money. So this kind of product is really beneficial. However, the biggest thing is how much is it going to cost, right? Because as we know currently, for most of our Advantage plans, there is no cost, right? And so, for example, if we look at this plan is about $35. Okay, something very decently affordable. And for example, you have the option for the client to take off the certain benefits on the plan. Like, let's say they feel like ambulance is not important, right? You can remove that or you can make it lower. And so if you remove that, then it goes from $35 to $31. But taking the entire silver lining, all 7 of those products, right, being the skilled nursing facility, the hospital visits, emergency room, you're pretty much paying about $35. Now, commissions, right? That's the biggest thing. I've always learned that the best way to get an attention of an agent is to talk about commission. And so, commission on this product is absolutely amazing. You're looking at about 55% on whatever you sell when we're talking about Advantage Guard. So, if they were to take the $35 plan, 55% of that is roughly, and then times it by 12 is roughly about $230 extra. And that's not even including the bonus program. And so if we look at the bonus program, bonuses are really good on this. Just by putting it on a electronic fund transfer, a checking or a saving account, that's an extra $50. So just by putting this product on an existing Advantage plan, you're looking about anywhere between $230 to about close to $300. Another product that United Healthcare Golden Rule has, and it's mainly for the ACA line, which could be added on to, existing lines here as well. Let's see if we change the date of birth here. It would be accident and critical illness plans, putting it on the ACA side of the business. So a lot of times, our clients have those high maximum out of pockets on the ACA side, being 9,400 in 2024. It is going to go down to 9,200 in 2025. So a lot of times clients are not very happy with that number. And so I tell my clients, look, the number one reason why you would reach that, God forbid, would be an accident. And so, for example, if you were to put in a accident add-on to that plan, if we were to change it to 10,000, the client would pay about $10. And this is for somebody roughly in the age of 30s. So for somebody in their 30s, if they take a 10,000 accident add-on, they would pay about $10 additional. And so what that would do is, God forbid, if they ended up in an accident, they would get a $10,000 check minus a $250 deductible, and that would more than take care of their maximum out of pocket. Commissions on a plan like this is anywhere between 35 to 40%, depending on your state. And including the bonus, which is the $50 for putting on an electronic fund transfer as a payment method, you're making anywhere between $50 to $100 extra just by adding this type of plan. Same thing with critical illness. Critical illness is the same way as accident, where you have a choice between 5 to 100,000. Starting at 5,000, the plan literally costs $3. So putting on a 5 to 10,000 critical illness, that'll take care of their maximum out of pocket, God forbid, in a critical illness situation. Commissions on that are like 50 to 60%, depending on what amount you put on it. So commissions are great. Very good way to opportunity to increase your income on new business as well as existing business. What I learned here recently is that most of the time ancillary products are sold. However, that has to be if you're offering that to your client, right? 65%, I believe it was 60 to 65% of the clients that actually take the product if the agent is offering it. However, if the agent is offering it, they're more inclined to take it from somewhere else. and it's a missed opportunity. And we don't want missed opportunities in this line of business. So we will host a more in-depth training on Wednesday here. I'm going to go ahead and post the link in the chat. So if you are interested on that training session where we go more in detail and show you guys ways of how you can add it onto specific products and cross sell, this way we can boost your income. Definitely check out the link, and that'll be at about noon on October 30th. So this Wednesday at noon. So I'll definitely post a link in the chat. And if you have any further questions, please feel free to reach out to me. I'll leave my contact information in the chat. Or of course, you can reach out to Justin, and he'd be more than happy to answer any of your questions. Thank you, guys.
Awesome. Umar, if you can stop sharing your screen there, because we're getting like a loop there. Thank you, buddy.
Sorry about that.
Yeah, no, that's good. So I have some questions, and the first one that's popping up in the chat. When is this available? This is available today, right now. So if you guys want to begin the contracting process, from what I understand, it's pretty simple paperwork. There's no test to take or anything like that, but you do need to get trained on it as soon as you're contracted. So Umar, as far as like, hey, I put in my request to get contracted today. I filled out my paperwork today. How fast am I ready to offer this product? And do you know about the time that they're approving contracts?
Yeah, so as soon as you contact Sam or Jessica on this, our contracting specialist, they're going to send you a link, which does expire in about 14 days. So as soon as you complete the appointment process, should take you no more than 5 to 10 minutes. Once that's submitted to United Healthcare Golden Rule, it does take them typically 24 to 48 hours, and then you're ready to sell.
Awesome. So people are asking for your information. So when you get a chance, if you can put it in the chat there, your phone. But if you guys go through the contracting process, if you're ready to get started, you're just going to email contracting@askhpm.com. And we're going to go ahead and start sending out the contracting information right now. So you've got people that are really happy. Lewis says, awesome info, Umar. Thank you for that. Lynn is asking, is this only for individuals or is this available for Medicare? So yes, there's products that are specifically designed for Medicare. And then there's ACA products. But Umar, if you want to expand on that.
Yes, correct. So kind of like what we briefly talked about, I know it's not a lot of time, but definitely when you join that meeting on Wednesday, we're going to go in detail. It's best to give it a chance and try to understand, is this a product that you like? Is it a product that you believe in? Right? We all know United Healthcare. And so to answer your question, they have products for Medicare, they have products for ACA. They even have products that I didn't even talk about right as of now, where typically for our folks that are not making any subsidy or not gaining any subsidy because of their higher income, they have products for those kind of people. Commissions are great, absolutely great all across the board, 55%, 40%, 35%. We're going to go all of it in detail this Wednesday on that training. I did see another question here by Mr. Walter Adams. So United Health is available in Texas as well as Tennessee. So they're in most states actually, and commissions are actually higher in some of the other states. But of course, once you get contracted, we're going to send the commission schedule. It's a great thing to have on your roster.
Absolutely.
Alyssa is asking, is there a cost to the agents? So there is a appointment fee that they have. It is roughly about $60. However, as soon as you're appointed into the contract, if you write 2 pieces of business within about a 2-month period, then they'll give you a $100 bonus. So that'll more than offset your cost of that appointment fee. Is it available in all states? It's not currently available in every single state, I believe, but all the major ones, there is. They might be in every single state, but they are doing product launches per state. So, for example, Advantage Guard, they are in the main states so far, but they will in the near future release it in other states. So, definitely, if you want to get in contact with me and ask me about a specific state, we can talk about it, and I can explain to you what products are and are not available in that Wednesday training.
Awesome. Awesome. So this is a change of pace for us guys. You know, this is the first time that, yeah, we're going to be asking your clients to pay a premium. You know, I know that some of you that have come up in the business are uncomfortable with that, but those of you that have been doing ACA, it's very simple, same process. In fact, that we are hoping very, very soon that this product line will be available on HPM Shop. So you can actually complete the Medicare Advantage enrollment and then go right into these products to add them on. So that's the whole reason why we've partnered with Connexure to give you one simple platform to add all of these products in it. So we are going to have to ask for cash on this. Now, Umar, you said the client gets a check in the mail. You know, let's say they go to the hospital and they're there 3 days. So, you know, the Advantage Guard product owes them the $450. How fast do they get that check? And is it a paper check, or how does that normally work to the client?
So it is typically like a paper check in the mail.
Mm-hmm.
How that works is essentially kind of like you said, let's say they owe them $450 because the client slept in the hospital for 3 nights. So
Mm-hmm.
at that point, they would file a claim. Filing a claim with United is very reliable, thankfully. They're obviously one of the best companies, so they don't deny claims unless there's a specific reason. So typically, how that would work is the client would go to their website. It's UnitedHealthcareMemberHub.com. And essentially, they would go in there, very simple process to file a claim, explain what happened, and the United Healthcare will get on that and they'll mail you the check. For the time of how long the check would come in the mail, I believe it's about 1 to 2 weeks. So it's not too far out, pretty fast. But of course, in the training, we would teach you how to file a claim for your client, how to file it with them. They have access to the member service as well. So many, many methods to file that claim. Also, another thing I wanted to mention is that this product is fairly new, like Advantage Guard. That's a product that has been out for a little bit, I believe, less than a year. And so actually, I just had a meeting with we had a meeting with the vice president of sales in United Healthcare Golden Rule, and he actually mentioned that Advantage Guard has actually increased 130% in sales within this time period. So a lot of clients, they love it. My clients, they love it. A lot of them are taking it. Uh, Absolutely something that hasn't been seen before, really.
Yeah, and so I'm doing the math here, and I'm going to share this in just a second because this is a great way to end the call. But a couple of questions people were asking. You know, Umar, thank you for putting your phone number in the chat. You've got the link there for the training that's on Wednesday at noon. So those of you grab that link, save that link, and then join us on noon on Wednesday. If you can't make it, we are going to record this. We'll figure out a way to record it, and then that way it'll be available to you. We're going to have lots of trainings, lots of webinars, lots of videos, lots of resources on this product. And then Umar is going to lead the charge, so he's going to be there to help you at least start getting your first couple of sales in this product until you're ready to roll. But in my opinion, every single Medicare Advantage customer that you have needs to have these products linked and synced in. And it's another way for you guys to make thousands of dollars a year and protecting your clients from, you know, the inevitable there. So that's what's going on. It does work with ACA products. It does work with Medicare. And that's why we're kind of scrambling right now to get this information out to you before open enrollment starts on Friday. And then for those of you that are working your Medicare book, you know, pay attention to this. Maybe you're working really, really hard right now. The great part is there's no lock-in periods on these products. So in January, you can loop back with your clients and start adding on these Advantage Guards products and really make a difference for them and make yourself tons of money in return. So let's just talk about the money really quick before we end. Let's say you have a new to Medicare client, okay? Now, Umar, I don't know if you and I discussed this, but look at the commission on this, okay? So next year, you're going to make $626 on a new to Medicare client. Now, you do the HRA, and let's say the average HRA is $150. Then you're going to tack on an Advantage Guard product, which in that example that you gave us was about $230 a year. Okay. Then you got a $50 bonus coming to you because you put them on EFT. And then maybe you put them with a Centerwell doctor or or one of these other groups out there. And let's say that's an extra $150. So you're making over $1,200 on one new to Medicare client. If you stack the commissions the way that I just explained it. And that's not even including critical illness or some of the other products that you talk about too, Umar. So, I mean, if you're just walking away with new to Medicare with like $600 in your pocket and you're happy as a clam, you're about to get twice as happy because now you can, with an extra 10 minutes of work, you can double your money. You know what I mean? So, Umar, you want to expand on that?
Yeah, absolutely. I mean, currently at this moment, I mean, I do both lines. I do ACA, I do Medicare. And even like my example is right now, typically when I have a client, most of them are taking Advantage Guard products. And instead of making the traditional 300 on a existing Medicare patient, I'm making anywhere between 400 to 500, right? That's 200 to 300 that you're getting per Advantage Guard, right? With the bonus involved. That's not even including putting them with Centerwell or putting them with dedicated. That's not even including the HRA. Just the base commission of Advantage Guard is going to get you anywhere between $100 to $300 extra in your pocket. Same thing with new to Medicare. It goes even higher with that. Same thing with ACA. Putting in an accident plan, right? Telling your client, well, look, your premium's $150. Here's a bronze plan, and the maximum is $9,400. Well, instead of paying $150, why don't you pay $160? Give $10, and you don't even have to worry about the $9,400 because you're a fairly healthy person. You're going to end up, God forbid, reaching that maximum. It'll most likely be an accident. So
Mm-hmm.
putting in $10, the client is most likely going to take it. And just by that 30-second conversation I just said,
Mm-hmm.
the client will take it and you're pretty much making $100 extra on ACA side. So you're increasing your commissions tremendously. And the great thing about that is you're working with your existing book of business.
Mm-hmm.
It's not like, you're actively, I know with Medicare and ACA, the only way really to grow is to get new and new and new business. But putting this combination of talking about this product with new clients as well as your existing clients, that's going to help you grow tremendously. It's helped me grow tremendously. It's honestly, out of everything I do, out of ACA and Medicare, it's my favorite line of business. I
That's
love
cool.
United Healthcare Golden Rule. They have it, commissions are good, agents are happy. That's all I got to say.
Yep. Um, okay, so I'm really, really excited about this. But Kelly had a question in the chat, and he says, after someone enrolls, what if they change their Medicare Advantage plan? So let's say you put on an indemnity product, the hospital indemnity product, the Advantage Guard, and then they decide that they change their Medicare plan. How does that impact the Golden Rule product?
So typically, if you want to, if the client changes their plan, then
Mm-hmm.
typically they can keep their existing Advantage Guard. It doesn't have to be specifically changed. I mean, of course, now, for example, if they're going from, let's say, from that Humana 269 plan to Simply Extra, right? Hospital co-payments on that is $200 per night instead of $150 per night. And so that would affect the client a little bit. And the answer to that question is if you wanted to put it from 150 to 200, the client would have to give up the Advantage Guard and wait a 60-day waiting period for them to reselect their plan. Or they can keep the existing 150. It's better than nothing. So at least 150 of that 200 is offset. So they can keep it. If they want to transfer it over to an Advantage Guard that's more suited to that specific plan, unfortunately, they do have to wait that 60 days.
No, that's great info. And I know we went over time, Umar, so thank you very much for, giving us this quick run through. Luis is excited. He says, this UH1 Advantage Guard is TNT. See you on Wednesday. So that's exciting. Again, guys, we're going to host training on Wednesday at noon. The link is in the chat there. It will also be in the training calendar on HQ. So those of you that know how to get there, or if you have any questions at all, you can email support@askhpm.com or chat with us in HQ to request your contract. Right now, today, it's available. Contracting@askhpm.com, and we'll get you rolling. Agency partners, we do have overrides coming on this product, so more to come on that soon. Other than that, we are really, really excited to offer this product to you guys because I think this will honestly, it has the capability of possibly even doubling your income for next year just on your current book of business. People that buy products from you, if they have 2 or more products, the retention rate goes through the roof. And so this is a great way for you to create stickiness with your clients and create additional income and generate referrals as well, because they all know friends and they're going to say, hey, I got this new hospital indemnity plan. You should check it out. Call my guy. And you might even get other lines of business. And Umer's told me that people have switched their Medicare plans to him because they were interested in the other products. So it works 2 ways. The more leads and more opportunities that you have to talk to people is the way to go. So with that, Umer, great job. Thanks again, buddy. We'll see you on Wednesday at noon. And again, Umer put his info in the chat there, his phone number and email if you have any questions regarding the product. But again, if you're ready to get started, contracting@askhpm.com, shoot him an email and we'll get you rolling right away. So with that, thank you guys very much for being here over time on Monday morning. We'll be here next week. Same time, same station until I tell you otherwise, because we are going to be switching systems. I really appreciate you guys being on the call today. So with that, have a fantastic and productive week. Take care, everybody.
Thank you, guys. Take care.